Thank you, Presiding Officer. I'm pleased to speak in this debate, both as a nurse with over 30 years of experience and as Deputy Convener of the Health and Sport Committee here in Parliament. The new GP contract for Scotland, which came into force in April 2018, aims to help cut doctors' workload, ensure a minimum income guarantee for GPs and allows general practice to become a more attractive career. The contract is still in its infancy and we are now embarking on year 2 of its implementation. In 2018-19, the Scottish Government invested over £110 million in support of the new GP contract and wider primary care reform, all of which is extremely welcome. Last year, I attended the Royal College of GPs annual conference in Glasgow and I was able to speak to GPs, including Dr Carrie Lunan, who's the RCGP lead in Scotland, and I got to hear firsthand from them about how they thought the contract would work. And there is some apprehension around whether the contract will work completely for rural GPs. And following these conversations and after discussions with former colleagues in the primary care sector, I wrote to all the GP practices across NHS Dumfries and Galloway area asking for feedback on the contract and if there were any other issues that they wanted to bring up with me, which I could then relay back to the Scottish Government. And I'm pleased that today I've had over 6 practices respond and I'm in the process of meeting with them to listen and hear their thoughts about having processes that we can further improve with the contract. And last week I met with the Charlotte Street practice in Dumfries. And at the meeting it was clear to me that the GPs agreed with much of what the contract has to offer, but they did make it clear that they had concerns over some of the timescales for what some of the contract states. For example, the length of time it might take to implement the pharmacists into practices, or pharmacists into practices. I was able to make, it was clearly made from the GPs that I met, both at the conference and from the GPs locally, that the way many believe we should be recruiting GPs, particularly to rural areas, such as in the South West, in my South Scotland region, is by improving transport infrastructure, both road and rail. And I'm sorry, but like this Harper's harping on again about the A75, 76 and 77. But the GPs did say that if people who may have studied, lived and their families are maybe in the central belt, but if they could have easy access to Dumfries and Galloway and Stranraer and all the places in between by fast train links or road links, that they may be more inclined to work in Bonnygalloway. So, Presiding Officer, I'm aware that the Scottish Government is actively working on recruiting and indeed retaining our GPs, and just in 2018-19 the Government invested £7.5 million in this, which included £850,000 for remote and rural areas. And for all the 160 remote and rural practices, the Scottish Government has made available Golden Hello payments to GPs taking up their first post in a rural practice and relocation packages of up to £5,000. GP recruitment concerns are not unique to Scotland. However, this Government's commitment, including expanding the remote and rural incentive scheme and relocation funds, should have a real impact going forward. And this investment of £7.5 million has allowed the Scottish Government to invest in the ScotGem programme, which will benefit Dumfries and Galloway in my South Scotland region. ScotGem, which is a partnership between St Andrews University, Dundee University and NHS Scotland, is a course orientated towards the current NHS Scotland workforce requirements, particularly in remote and rural GP practice. 55 students in total were matriculated with St Andrews University in August 2018, and I'm pleased that the first group of second-year students will arrive in Dumfries and Galloway in August this year. Happily, 5 GP practices across Dumfries and Galloway are set to take part in the pilot year of the project, and I look forward to seeing its outcomes. So, in conclusion, Presiding Officer, I'd like to thank the exceptional specialist GPs across Scotland, and I welcome the positive steps being taken by the Scottish Government to help with the recruitment and retention of GPs.
Annie Wells, followed by Neil Findlay.